We'd like to welcome Jason Boylan, who is the founder of Third and Church Healthcare. Thanks so much for being with us, Jason.
Thanks for having me.
Tell us a little bit about Third and Church, if you will, please.
Third and Church Healthcare is an urgent care walk-in clinic downtown Nashville, right in the core of downtown. We're open for the public to walk in for different illnesses and injuries. We take care of people.
A lot of people curious about urgent health care or places because they know the ER, they know their doctor, but at the same time, when do I go to visit a place like yours? And I've noticed a lot of these, as I'm sure a lot of people have, kind of popping up. Why do you think that is?
Well, demand is one. I mean, more people are getting on plans with Affordable Care Act, so people are trying to access health care. Oftentimes, they're not able to get in to see their primary care provider, so they need something and they need to have it that day or within a reasonable time frame. And oftentimes there's a wait list, several days, often weeks, to see your primary care person. So that fills a gap, especially when it comes to common illnesses and injuries.
Yeah, a great convenience factor. And obviously your establishment is located downtown. What type of services can you tell folks urgent care clinics usually provide?
Urgent care clinics in general, they take care of a lot of different illness and injuries, mostly common injuries and illnesses such as, upper respiratory infections, bronchitis, sinusitis, but also there's another level of care that people may not consider, such as laceration repair, minor fracture, stabilization, even just, urinary tract infections. These are, some things that you may not consider. They have full lab, often X-ray, and services that you would also find in a hospital setting. So.
Yeah, a lot of folks, I think, if they were to feel as though they broke a bone or something like that, the first thing they would do is probably go to an ER. And so you're saying, these facilities can actually take a look at the injury itself. Right.
Yeah. Facilities like mine and other urgent care clinics, almost all of them have urgent, X-ray equipment. So if there's a minor fracture that needs to be stabilized, and like if somebody came in, needed to be seen, we would take an X-ray, stabilize the injury, and get them connected to an orthopedist, much like you would be in an emergency room department.
That being said, tell us what kind of healthcare professionals you can find in an urgent care clinic.
Well, there's a team of professionals that take care of people. For instance, you'll have typically the provider will either be a nurse practitioner, physician assistant, or an MD. You'll have X-ray technicians, medical assistants, and other supportive care employees that help make the experience more efficient, quick, and quality.
Sure. When someone comes to see you and you feel they definitely need to go and see a specialist, or maybe they should be going on to the ER, what do you do in that situation?
Well, I've trained, in my particular facility, we've trained the staff to really recognize what is an emergent condition. So if somebody comes in and they're complaining of chest pain or acute shortness of breath or have had a major trauma, then we will initiate the 911 protocol and get them to the emergency room as soon as possible so they can have a good outcome with that. So, but those are exceptions, and we're ready to take those on when they come in so that we can get them where they need to be.
Now, Jason, we should point out you actually had worked in an ER yourself as a nurse practitioner. Mm-hmm. So did you see some patients coming in to your facility at the time and thinking they could have used something like this instead? Yeah,
so at the emergency department, there was multiple visits. I wouldn't give it a statistic in my mind, but it just seemed like every day I was asking myself, why didn't this person have access to another facility to take care of this non-emergent condition?
Sure.
And I think, a lot of it is education about what urgent care centers can do, and, other walk-in clinics. And, that's just but to answer your question, yes, there was multiple visits that came in that just were not emergent and could have been seen in an outpatient center.
Let's talk a little bit about cost too, because you said, a lot of people, signing up for insurance and with the Affordable Care Act and that kind of thing. More people have that kind of insurance. Obviously, urgent care centers do take that, the insurance. But it's a good thing for patients, I assume, a lesser cost to them in the long run. Yes.
Yeah, it's well documented how much emergency rooms cost versus an outpatient center, and with more and more costs being passed back to the consumer with higher deductibles and all that, it behooves the patient to really figure out what would be the appropriate place to visit for the appropriate cost. Now, that's not that being said, you're not. That doesn't mean you're going to go to an emergency department or versus the urgent care. You're going to go to urgent care versus emergency department based on cost. If you have an emergency, you're going to the emergency room.
Absolutely.
But yes, cost is a big deal.
And obviously, so is convenience. For a lot of these places that have popped up, you're going to want to be able to go there. Maybe it's right down the street compared to a drive to a hospital or something like that, or your doctor's office. Would you say the convenience factor for these clinics, as well as cost, is probably the biggest benefits for the patient?
Absolutely. I mean, if you go to an emergency department, they're going to take care of emergencies first. So you're going to be pushed to the back of the line, per se, and that can be a several-hour wait. If you're in there for an upper respiratory issue or a urinary tract issue, something that could be treated outpatient, it is going to be a long wait, most likely. So yes, the urgent care centers, no doubt, will get you in and out quicker. Yeah.
When people, who are watching this program or sitting at home, how do they decide if they can go to your facility? If something happens, if there's a fall or if they're sick and they don't seem to be getting over it, what do they need to be asking themselves before they go to your clinic or a clinic like that as opposed to the ER?
Well, there is a lot of information and misinformation, of course, out there. And, I think it'd be nice if you had a medical home to call and you could ask the nurse there and, just to get some direction. Most people have a primary care office that takes care of them, and they can call and the nurse may direct them to the urgent care, or they may direct them to the emergency room, or they may try to work them in. That would be the number one place I would call, is your primary care facility, so that they're familiar with your case and they can kind of direct you. I would caution people to self-diagnose on the internet and different things that happen all the time.
I was going to say, in this day and age, I think people are so prone to go to that computer and kind of check it out and say, oh, maybe what do I have? Is this okay to go there? But
right.
But you're saying obviously calling your healthcare provider is number one.
That would be number one. It's not cut and dry.
Sure.
There's a lot of gray areas in these conditions. So.
Absolutely. What do you recommend to people if they're unsure about a health complaint? What to do as far as that's concerned?
Well, with the increased amount of walk-in clinics, and if you're unsure, then most likely you're going to want to get some reassurance.
Yes.
And so the really way to do that would be see a licensed professional to give you that.
Yeah, no matter a walk-in clinic, your doctor, whomever.
Correct.
All right. Well, Jason Boylan, thank you so much for your time today.
Yeah,
Great
thanks
information.
for having me. It's been fun.
Absolutely.